Okay, now I know a lot of our listeners will be very curious on what you're seeing on your lung ultrasounds. Anything special or unique to COVID-19?
Yeah, I think that in our experience, let me start from here. This hospital is a hospital with a huge competence in ultrasound. In our hospital, just because we did a very long and very deep job in training people in the last 10 years, because WinFocus did an amazing job here in Lodi. And now every single floor of this hospital has an ultrasound machine, or more than one, and all the physicians, so pediatrician, neurologist, surgeons, intensivist, whoever is working here is able to handle a probe and to perform the point of care ultrasound. So point of care ultrasound means to bring the probe in a physician hands and try to assess, to better assess and to monitor the people, and every physician is bringing his own experience in order to decide what is important for patients. So let me say that this is the baseline where we have been starting. But we, just because we were so confident with the point of care ultrasound, and just because all the different teams are fully convinced that this is a huge and a real power tool, we decide to use ultrasound to perform in the very beginning the triage to assess coronavirus lung involvement, and to decide where to bring the patient, and also to treat also the comorbidities, because sometimes we receive young people with only ARDS and or only a lung involvement from the pneumonitis to bilateral pneumonitis, from ranging from pneumonitis to ARDS. But also sometimes we receive elderly with other pathologies and with other comorbidities. And so ultrasound is also very useful to better assess the patient in the emergency department. And just because, as I mentioned, this at some extent is a sort of worst scenario, you know that ultrasound in where the situation is critical, just how this is the message of WinFocus, World Ultrasound Network, focus on critical ultrasound. And critical means when you have or a critical situation, just because the patient is very sick, or because you have a very sick patient also in a critical situation, just like we are, because we have very sick patient, but we have also a huge disproportion between resources and number of patients. So ultrasound is clearly the answer. And we did, let me say that also, if I have to compare what we did in this hospital, we have around this area many other hospitals which really collapsed under this sort of tsunami, let's say, sort of wave of patient pushing. They have been overwhelmed and they collapsed just because they referred themselves to CT scan, waiting for a CT scan report, and waiting for the CT scan be available for the other examination. And this has completely slower and made the emergency department very slow in addressing a large number of patients. And this is something which doesn't work at all. So my experience and our experience and exactly what we did is to bring ultrasound quite in the middle of the decisional tree, and this has been really, really effective. So again, for us was blood gas analysis, chest X-ray, and chest X-ray is very important when the chest X-ray is very, very wide, it's a clear positive chest X-ray. When the chest X-ray seems to be negative, ultrasound has a huge capacity to better discriminate if a lung involvement is present, at what extent lung involvement is present, and to perfectly match this lung involvement with the for example with the clinical approach. For example, to decide if we can bring the patient not in step down or an ICU, and the patient was not so sick, we use also the walk-in test. So bringing together blood gas analysis, chest X-ray, lung ultrasound, and walk-in test has been a huge solution to decide who were the patient that was possible to discharge. This is also another issue. If you have no clear where to discharge, when to discharge the patient, and if the patient that you are discharging is addressing to the right place in order to stop the spread of the virus, this is a mess. So ultrasounding has been really, really effective in doing such management.